So let me do some introductions. Greg Blose, I'm president and CEO of the Palm Coast-Flagler Regional Chamber. I wanted to share with you that we will be welcoming some other guest speakers on in a few moments. Josh Woolsey with law firm Woolsey Morcom will be joining us, along with Flagler County Department of Emergency Management Director Jonathan Lord and Flagler County Health Department Administrator Bob Snyder. And really what all of this is about is, of course, the increase in the COVID cases here in Flagler County, which is very concerning. And so I guess where I wanted to start first was to let you know that this, for me personally, was not an exciting press release or recommendation to make. I'm not a happy about wearing mask kind of guy. I'm not excited about anything having to do with COVID. I've had COVID. I've had the vaccine. My family went through all this last year, so it hit home for us, and we're really encouraging folks to make sure that they're protecting themselves and their employees and their businesses. And the businesses really is what we're here to talk about today, because recent CDC recommendations are urging people to get people who have been vaccinated to use a mask when they're in indoor public settings in areas of substantial or high transmission. And so what I really want to do today is share with you what that means. I want to show you what it means. I want to go through the legislations that our business partners can really understand exactly what the legislation says, so that your business can make your own decision on how you would like to move forward. So let's kind of just start and say that during the 2021 Florida legislative session, the chamber successfully advocated for the passage of Senate Bill 72. Now, Senator Hudson and Representative Renner were on board with this. It's a great piece of legislation that shields businesses from being sued for COVID liability. So in other words, if a customer walked into your shop or frequented your place of business and said, and claimed to get COVID because you or your employees were not following health guidelines, then they would have to, the burden of proof would be on them to prove that you didn't follow those guidelines, but also they would have to have a doctor sign off on the fact that, yes, it was possible that this could have happened in your place of business. So the burden of proof really being placed on those that make the claim is a really good position for places of business to be in. However, businesses do have to make a good faith effort, and this is actually spelled out in the bill, make a good faith effort to substantially comply with authoritative or controlling issued health standards or. So really what we're talking about is what does that mean? And I think this bill was just signed March 29th by Governor DeSantis. The bill was implemented on July 1st. So really what we're talking about is a piece of legislation that is only, 5 or 6 weeks old. And so there's a lot of gray area about it, especially when the CDC comes out and says, okay, if you're vaccinated, you should wear a mask indoors in a public setting. And if you're not vaccinated, you should wear a mask indoors in public settings. And so businesses are very confused about what to do. And hopefully we can provide a little clarity on what all that looks like. So I'm going to share my screen here for a moment and show you exactly what I'm talking about, so that you can kind of look at what I'm looking at and start to make some decisions on your own about how you would like to handle this. So let's start with, I was going to go through the legislation. What I'll tell you here is Senate Bill 72 is only 12 pages long. So I would encourage y'all to go read it for yourself and develop your own recommendations or opinions about it. It does reference government. It does reference business. So it covers, and healthcare. So it does cover kind of the gamut on everything. In terms of the big change, I think, that happened last week, and we'll have the experts with the health department and emergency management come on. But in my opinion, the big thing that happened last week is this: when the CDC came out and said, if you're in a substantial or high community and you're vaccinated, you should be indoors. So this is actually the CDC's level of community transmission tracker in Flagler County. And here you can see we're in red, which is high, and pretty much the entire state, with the exception of Glades County, is in this. So what that means is if you're going to follow the CDC's recommendations, then people that are indoors, this is the key, indoors in public settings, should be wearing the masks according to CDC, vaccinated or not. And so really what the chamber wants to do is make sure that we're protecting your business and your employees with different recommendations. Now I want to show you, hop over to the Mayo Clinic website here. You can see at the top. Mayo Clinic has this, and several pages have this cool little, trend tracker. It's a timeline of COVID cases in Florida. So here you can see at the moment, and I started on the 4th of July because I think we can all kind of relate to 4th of July, where you know where you were on the 4th of July, right? So here we have Flagler County's average daily cases on the 4th of July was 9, okay? Now what we're gonna do here is press play, and it's gonna start to change colors, and you'll see how quickly this has changed. And I also want you to pay attention to a trend that happens here. So hit play. The clock is ticking. Here you can see on the bottom, and the cases are going up. The cases are going up. And then right around the 20th of July, we pass what I believe is the moderate level. So Jonathan and Bob, I'll really need your help here. What constitutes the moderate level of transmission? Well, it means every 7 days per 100,000 residents, how many COVID cases did we get that are new? So somewhere between 10 and 49 gets you to this moderate transmission level. That level is really important because the CDC calls out that if you are in the substantial or high transmission levels, the orange or the red, then vaccinated people need to be wearing masks indoors. The moment that we get to yellow, theoretically, you would be able to take those masks off and still comply with CDC guidelines if the community is healthy enough. So Bob and Jonathan, I'll really be looking for you to confirm that here in a moment. But this is really what the chamber has been looking at, is when the CDC comes out and says, hey, what are we doing? This new Delta variant can be spread by people who are vaccinated, which is why vaccinated people need to wear the masks. It's a pretty big deal. And so you've heard a lot about, what the governor is doing. And obviously many of us have seen the executive order that he made with regards to masks in schools. But I'm working to better understand if there are some state standards, because the other part of the Senate is that it says, okay, what if there are conflicting standards, right? The CDC has this standard and the state of Florida has that standard. And the law says that if you're following any one standard, that you would be exempt from COVID liability. So that's also really important, right? So what we're looking for is, how do we make sure that businesses are 100% covered? And I guess I'll pause there. It might be a good time to take questions, or maybe we just kind of go right through this, but let's pause for just a minute and see if anybody has any questions about what you've heard and kind of the rationale behind why the chamber is doing what it's doing. So feel free to speak up, and we'll take you one at a time.
Hey, Greg, it's Bob. Just real quickly for the audience here, let me just share 2 data points because this is recent. So yeah, the state of Florida, 20% of all new cases are stemming from the state of Florida. We're a high transmission state, and every county right now, except for the one in Glades, is considered to be a high transmission county, including Flagler. So just one thing to share. We are averaging anywhere between 85 and 100 new cases a day. On Sunday, we had 130 positive COVIDs reported for one day, this past Sunday. That was a record. And right now, today, our case investigators are investigating 80 cases. And that does not include contact tracing responsibilities. And the hospital broke a record today here, Advent Health Palm Coast, with 85 people in the hospital with COVID. either an inpatient admission or an emergency room admission waiting for a bed. Keep in mind, we're only about 134 beds, I believe, total. So think about it, 85 folks with COVID and 94% to 95% of the patients are unvaccinated. So just so that I can help confirm what you just shared, and that trend line piece that you did was exceptional. So thank you for doing that.
Thank you, Bob. I appreciate it. Anybody else want to jump in here before we turn it over to Josh Woolsey to kind of talk about the legal aspects for business? Okay. All right. So I don't know where he is on your screen, but on my screen, he's right below me. And that's Josh Woolsey with the law firm Woolsey Morcom. Josh was named as one of the, his firm was named as one of the top 100 in the state by Florida Trend. And so really pleased to have Josh on board as a partner of the chamber. And Josh, I appreciate you taking time to join us here and answer some questions. And the first question I'd like to talk to you about is the Senate Bill 72, talk about the law. It's very new. And I guess the first question is, have there been any suits filed against businesses under this COVID liability that you're aware of? And what are you seeing out there?
Yeah, well, thanks, Greg, for the opportunity to participate in this dialogue. As a plaintiff's lawyer, what that means is I represent businesses and individuals who have been injured or damaged, whether that's financial damage, physical injuries, mental health injuries. And so I'm the one that sues businesses when there's liability. And so I'm the guy that'll be looking at this statute to potentially file claims. And I'll tell you that the plaintiff's bar, the lawyers on my side of the table on this, we all talk. And I've gone directly to the source. I've called the circuit judges and talked to a lot of the circuit judges and said, what are you seeing? Are you seeing lawsuits filed under this immunity bill, and how are they playing out? And what I've been told consistently is that nobody's seen one yet. And I think there's a couple reasons for that, right? There's been 4 months that we've been live with the statute. And if you look at the statute, there's some things that us lawyers have to do that's good for the businesses, that slows the process down, makes us really spend some time investigating, right? With a car accident case, I could turn around tomorrow and file a lawsuit. With a case like this, I have to gather their medical records. I have to have a physician, a licensed state of Florida physicians, look at them, review them, and give me an opinion under oath that there's a valid claim. And then I can file a lawsuit. So you've got a process that I think slows these cases down from being brought. And then you've got the fact that once a lawsuit is filed, you have additional hurdles. Most of you know that you have the right to a jury trial. Well, with this statute, there's a step before that. And the step is that these judges are the gatekeepers of these claims. And so these circuit court judges, they're required under the language of the statute to evaluate whether or not the business has substantially complied with the authoritative and controlling government issued health standards or guidance. And so because of that, us lawyers, as you all know, we fight about the definition of words, and there's some words there that are up for debate, right? And the facts would dictate how the decision may be made. For example, what does substantial compliance mean? It doesn't mean complete compliance. What would it mean to result in a decision that you've substantially complied? And so then what's good faith? What's a good faith attempt? So the judges will rule on that, but there needs to be discovery, right? If I file a lawsuit tomorrow, I'd have the right to question the business owner. What did you do? What did you do to comply with these standards? What policies and procedures did you have in place? So I say that to just point out that the process will take some time. And I don't think the judges have had a chance in this 4-month period to weigh in. And I've asked them, and I've not heard of anybody ruling on the issue yet. And then I'll end it with this. We have a Google for lawyers. It's called Westlaw or Lexis, where we can look and see if there's been rulings, and it cites the statute. There is not a single case, appellate court case, citing to the statute yet. So that tells me right there, there's been no trial court order. When you file a lawsuit, it's in the trial court level. And when a judge makes a ruling, especially on a case like this, where they either say you can't bring a claim or you can, those can be appealed to a higher court, and those are recorded. And there's been no decisions by an appellate court yet. And then after that could be the Florida Supreme Court. So all of us plaintiffs lawyers are kind of waiting to see how the courts will interpret these different terms, and then how they'll apply facts to determine substantial compliance or a good faith effort. And so that's why I think we haven't really seen a lot of these lawsuits play out to the point where we have any real direction from the judges who will address them.
So part of the reason the chamber issued the guidance about urging businesses to at least consider this is some of the confusion surrounding the CDC recommendations versus what people have come to know as mandates. So this time around, local governments are not doing mandates. The governor's kind of put his foot in the ground and said that's enough with the mandates for now, at least. And so I guess, I would like to ask you, what would you say to a business that says, I don't have to abide by the CDC recommendations because they're just that, they're recommendations, not requirements?
Yeah, I would say you're right, but you could expose yourself to liability. The statute, sometimes you look at what words are there and what words are not there. If you note, when you look at, it says substantially comply with authoritative and controlling government issued health standards. It doesn't say mandatory government issued health standards. That implies to me that the recommendations also apply. And Greg, you pointed out in your opening remarks that you only have to comply with one source. And so, I would tell businesses that I do think that one of those sources would of course be the mandatory requirements. All businesses should comply with the mandatory requirements. As for the recommendations, each business has their own risk tolerances, and each business operates differently, and to comply with certain recommendations might be more difficult for some than others. It might completely shut down a business's customers may not come shop there for certain reasons. So I think each business has to look at, when you're dealing with the recommendations, not the requirements, but the recommendations, you've got to think about how's it going to affect your business and what's your risk tolerance. Another thing I'd mention to businesses is, when you get sued, who's the first person you call? You call your insurance company and you hope it's covered. I'd tell all businesses to look at their insurance policies and see, am I going to be covered? Is there a requirement that I comply with all these Florida statutes, or I don't get a defense in the case, or they don't indemnify me if I lose? And so I think businesses should also look at their insurance policies and talk to their agents and see, what happens if they do get sued on a claim like this. So it really depends on the risk tolerances of each of these businesses with respect to what I'd tell them as to the recommendations as compared to the requirements.
One last thing, Josh. Director Jonathan Lord, but last point, Josh, I wanted to ask you, documenting was one of the things that we specifically spelled out in our press release and on the website, that regardless of what a business does, it's important to, at bare minimum, document what you're doing. Kind of talk to me about why that's important in your eyes from the legal perspective.
Sure. So let's say I'm the bad guy and I file a lawsuit for somebody that claims injuries due to COVID, and you as a business, you're the defendant, and you claim I've complied in good faith with these standards. Well, what am I going to do? I'm going to take your deposition and I'm going to ask you what you've done. I'm going to send you a request for documents, and I'm going to ask you, I'm going to say, I want to see your policies and procedures. I want to see what signs you had up on your door. I want to see what evidence you have that you've actually in good faith comply with these standards. And so if you're able to I can tell you, as a lawyer who's filing those lawsuits, if I showed up and filed a case, and then I was provided these policies and procedures that indicated this company was legitimately trying in good faith to comply with these standards, and I took a deposition and I was able to establish that the employees said, yeah, look, we were following all these things, I would instruct my client, look, I think it's game over at this point. I think that we, not only are we prevented by law, but we don't have a valid claim against this business anymore because they've done what they could. But if you don't document it, then I'm going to be able to turn around as a lawyer and say, what do you mean you had no policies and procedures to be able to keep up with the standards and to comply with them? And I'm going to be able to ask your employees, and if they say, I don't even know there was an immunity bill. I didn't know we were supposed to comply with certain things. Then it's going to become more of a gray area and a question for the judge and potentially ultimately a question for the jury.
Josh, I appreciate your time. If you have the time to hang on with us, we'll do a Q&A at the end, but if you got to run, we understand. Really appreciate your partnership and sharing your insight on this, however. Thank you.
Of course. Thanks, Greg.
All right, let's kick it over to Flagler County Department of Emergency Management Director Jonathan Lord joining us on the road today. Jonathan, I wanted to ask you to share with us what the latest data says about this most recent COVID spike in Flagler County, and especially kind of considering that trend chart we just saw. You know, July 4th, we had 9 cases here. And where do we find ourselves at a much higher level now, obviously.
Yeah, well, thank you for having me, Greg. I truly appreciate it. I think what I'd like to first say is really just kind of set some perspective and kind of set the stage a little bit. You know, COVID really started becoming a big issue in March of last year, right? That's when we knew about it in January. Obviously, some folks knew about it before that, before the holiday seasons in 2019. But, you know, it became the bigger issue in March, April. But through most of that year following that, so from March to March, so March 20 to March 2021, maybe even toss in April and May of this year, Flagler County, and I say this just to truly set kind of the stage here, Flagler County truly was at the race to the bottom, and if not at the bottom, in a good way, of the case rate for the state of Florida. We constantly hovered as as the lowest or the second or third lowest case rate in the entire state. And Bob and I were beyond ecstatic about it, and we're proudly able to brag to our colleagues in other counties. Again, and it wasn't because of what Bob and I did or what our team did, it was because our community took the CDC guidance. And again, CDC's wording is always guidance. They use the word guidance, but it becomes a de facto standard. Our community did what we needed to do collectively, and it was amazing. You know, vaccines became available. I think we got our first batch of vaccines at the end of December. And then we started getting pretty regular deployments of vaccines starting in January. And Flagler County was to the opposite, the race to the top, but in a good way, of getting our residents vaccinated. And yeah, and as you all remember, the state did it by age group. We started, you know, over this age, and then they dropped it by 10 years and dropped it by 10 years and so on and so forth. Again, we're not the most populous county. We're not the least populous county. We're a solid entry-level, medium-sized county is how I like to refer to our county population-wise, and we're obviously rapidly growing. But we had one of the highest vaccine rates, especially when you talk about our senior citizens who were the first group, 65 and older, to get those vaccines. We worked at the race to the top and constantly within the top 10 counties of percent of seniors vaccinated. We held on to that when it was 50 and older. When it was 40 and older, we started slipping a little bit. And then when it was opened up to anyone over the age of 12, unfortunately, we lost our lead in that, but we were still holding pretty good with one of the lowest case rates. As you all saw, and you picked a pretty good date, July 4th, I would say maybe you went back to June a little bit, sometime in June, and I don't know there's an exact date to it, sometime in June, our world changed. It started slowing down in May when the number of people being vaccinated, the percentage of, the percentage of residents seeking vaccination, when we opened it up, we had a lot less residents seeking vaccines. I mean, we didn't even have enough demand to keep the massive site open when the health department was inoculating people and we had volunteers out there over at the fairgrounds. Our demand wasn't even there anymore when we dropped that age. And we shut the site down, which is okay, because any of us could right now walk into any pharmacy in Flagler County, including the ones in the grocery stores, the Target, the Walmart, walk over to Bob's offices in the health department, and you could get vaccinated in 10 seconds. So it's not a bad thing that we shut it down. The private sector was able to take up the slack and it's readily available. So I really want to set the stage that we were the best or the top 10 counties for the case rate and for the vaccine rate. And then it all started changing rapidly as we approached late spring and we're obviously in summer now. Bob talked about where we are sitting today, just to give you some perspective. So right now, the health department up in Tallahassee releases data on a weekly basis. We ended last week with a case rate of 570 per 100,000 in population. When we were at the race to the bottom a year ago, we were in very low double-digit numbers, the case rate 10, 11, 12, below everybody else. It was amazing. So we have vaccines available. We now know that masks do make a difference, yet our case rate has a whole extra digit in it now. So that's what's, very, very frustrating. The other thing, age. So our senior, we got to a point where we are well over 80%. I don't know the exact number right now of our seniors are vaccinated. And again, we hit that number very, very early, well before other counties do it. But our case rate now is we have 26% of our cases are showing positive. At last week, the average of last week was 26% positivity rating. That's a very, very high number. And the age is literally dropping week by week. It's getting younger and younger. So our seniors have this built up immunity, but as we drop below senior citizen age, the immunity level is much lower because there are not as many people, and the percentage are not vaccinated. And then, we opened up as our residents got more vaccinated, myself included, we all took our masks off. We stopped wearing masks. And then, unfortunately, we all did the right thing. And unfortunately, along comes the Delta variant, right? And I know Bob will talk a lot more about that in vaccines. I don't want to steal his thunder on that. But that became a game changer too. But it wasn't Flagler County issue. It's a national problem, obviously. And Bob will definitely talk more about. So the big thing that we want to notice is our numbers have changed drastically, yet we have better tools in the arsenal now. We have proven masking and we have vaccines readily available, yet we are doing tens of times worse than we were a year ago because we got comfortable and because this new Delta variant's out there, and it's primarily hitting younger people. The only silver lining, if there is a silver lining, I don't really like the term silver lining, I just can't think of a better term, is we're not seeing a ton of deaths right now. Compared to what many other communities are. Our hospital is, as Bob already shared, our hospital is packed. Numbers we never even got to 80 some patients. Bob and I and Wally Diakino, CEO over at Advent Health, we got nervous when we saw 20 people in the hospital at the peak, the quote unquote peak of the pandemic. 20 would be beautiful right now. It's such a different world. It all comes down to this variant. So it is very different. It is affecting a different population, and we're also seeing people that were vaccinated getting it, but luckily those that were vaccinated and do get it are not getting as sick. They're not ending up in the hospital unless there's other underlying conditions.
You're listening to the Palm Coast-Flagler Regional Chamber's COVID Zoom call here on August 4th. The person you just heard speaking is Flagler County Department of Emergency Management Director Jonathan Lord. Jonathan, not really your place, but I think the weird part about what's happening now, first of all, we've been living this for, I don't know, it feels like 2 years, I don't know. But so one is just like people are burnt out on it. I'm burnt out on it for sure. But the second part is there isn't the local government component this time around, where they're saying, mask mandates and stuff like that. Just talk to me about what the insight into why behind that. And I know kind of DeSantis has got some role in that too, but what's your take on, as somebody who's plugged in, on why not have those things this time around?
So again, just to set the stage a little, so this time last year, 3 of our cities, Flagler Beach, Bunnell, and Palm Coast, all had mask mandates in place. The county had a very strong urge. However, in Florida, those mask mandates were not enforceable. So they basically had the same effect as a strong urging, because it doesn't matter if you didn't follow the mandate, our state government did not allow them to be enforced. So this time around, could something similar be done? The governor did, and the legislature did make sure that we cannot do mask mandates. Governments cannot issue mask mandates. They cannot do anything that infringes upon people's private rights, personal rights, civil liberties. So we cannot do something like that. Could we do something like an urging? Yes. So the county could do the exact same thing it did in the past. The cities could do what the county did in the past and adopt an urging. But in all honesty, the benefit of doing that in the past, whether it's urging or the unenforceable mandate in the past, was because at that time, the general populace didn't know what you could do. It was growing, so things were changing literally on a day-by-day basis on what was the right thing to do. We all remember even the CDC said do not mask originally and then do mask. And there's reasons behind that. A lot of it was to limit masks to healthcare workers, so the whole population wouldn't go buy those masks. You couldn't go buy cloth masks. Yes, now we have a huge industry involved in making cloth masks. You can buy a mask anywhere. So it was a little bit different that got us to that point before. In today's world, everybody knows. I mean, unless you're living on a rock, even if you're living on a rock, everybody knows the actions you can take to protect yourself now. So I don't know that there is any additional value in a local government. There's no actionable additional value in a local government trying to do a mask mandate, even though it's not enforceable, or even doing the urging. I think the benefit that our local governments collectively can do, and we're doing this together, the cities and the county and the health department, we all talk constantly, is to really just get the message out. These are the tools available to you. You can go get a mask. You can get disposable masks. You can get cloth masks. You can get masks that have wonderful business logos on them and support our wonderful businesses in our community. They're readily available. I think our job as government is just to say, hey, don't forget, this is what the CDC is saying, because we are currently a red or high transmission community. Therefore, everyone should be masking. Everyone should also be getting vaccines available. Here is the science behind the vaccines. It is a very personal choice, but here is the science behind it. And here's a place you can go to get educated and get yourself to that comfort level where say, hey, yes, I want a vaccine. And then it is government's job to say, hey, these are the umpteen places. I think there's probably 20 locations in Flagler County, give or take, that you can go get a vaccine at any moment, except for maybe in the middle of the night, but there might be one or two places you can do it in the middle of the night. So I think that is government's role right now, is to say, listen, here's the information. And just in case you just didn't realize it's there, here are the umpteen ways we can share with you the sources of the scientific-based information. Absorb it, make your decision, and do the right thing, whether it's for residents, whether it's for businesses, whether it's for visitors. And here are the places you can do that once you've done once you've realized what you want to do for yourself. So that's why it's a little bit different. It's a lot of the things that we did and made mandates in the past when we attempted to make those kinds of things. It's a little bit different because the education and the need to educate is a little bit different now. It's more of, I'm coming back to it, it's more of us saying, this is where you can go get these tools. This is where you can go get the information so you can make that appropriate decision for yourself.
Last question before we turn it over to Bob Snyder, Jonathan. I mean, closing thoughts here. What is the most important message from a public safety perspective that you would like our businesses to hear?
I think number one, I think all of our public safety partners in the county, the cities, we all want our businesses to be open. We really, really want our businesses to be open. I mean, it does not make sense for us to shut our businesses down again because it destroys our economy locally as well as nationally and statewide. And it's not hard for our businesses to stay open. The tools are there for businesses to make the right decisions about their employees. The tools are there for your customers, your clients to make the right decisions and have access to the tools to protect themselves. My big fear right now on the public safety side is not that some government mandate is going to put our businesses out of business. My concern, or is going to negatively impact the business financially. My big concern right now on the safety side of things is our businesses, you're going to lose staff temporarily. You may lose them for 2 weeks because you get a breakout in your business. That's going to hurt you all. That's going to hurt you more right now than some new government rules going to hurt you. And we want to make sure that you all have the right tools to protect yourselves, protect your staff, and know how to go get them vaccinated or know how to give them the masks that they need to make the decision that helps keep them safe and healthy. So that's really what the message I want to get across is we want you to stay open. We want your staff to stay healthy. We don't want you losing staff. And a lot of you are still having a hard time finding those few staff. We don't want you to lose those few staff and you have to shut down and not offer services, your full range of services anymore. We really want you to know what's available and help educate your staff and your clients to take care of themselves, and you can all prosper as local businesses.
Well, Jonathan, let me just say, before I came here, I was at the state chamber for 8 years, and many of those years I spent at the state EOC. And when I got here to Flagler County, I did not expect to have someone of your quality in this small county. And hopefully you stay here forever. But to anybody on the call, Jonathan is just on top of it 100% of the time. So, kudos to you and your staff for what you do, and knock on wood that we can continue to make progress. So I don't know if you can stick around with us. If you can, great. We'll do some Q&A, but if not, I know you're on the road. Really appreciate your time today. Thank you.
Thank you for having me. And I don't just say this, I really love our community. It is an amazing community. It's a burgeoning community. It is a great place to raise a family, and we have great businesses for us all to support. So I'm all in at this point.
All right, let's shift over to Bob Snyder. He's the administrator at the Flagler County Health Department. Bob, I kind of want to talk to you about vaccines and, get a better understanding of where we are on vaccines and what are the current trends and, stuff that you're seeing as the leader of the local health department.
Oh, Greg, and thank you for the opportunity, and good afternoon, everyone.
Maybe they'll
I want to just reaffirm comments that Greg just made about Jonathan. He and his team have just been fabulous partners for us and supporters for the health department, especially when we began testing at the college together and then transitioned over to vaccinations at the fairgrounds site where the majority of our community got vaccinated. And total vaccinated folks are 63,000 at the moment. But even when we had our mobile sites, Jonathan has been with us every step of the way, Jerry Cameron included, and now Heidi. So we got a great partnership. And I really think that played a key role in us having the lowest case rate per capita, really until recently in the state of Florida. But I think we're still at the bottom. You know, the very sobering stats that I shared are definitely true. Our jaws just dropped, you know, my staff and our team and the hospital staff and the medical community here. And I'm sure you too. I mean, this was just not really expected. We did think there might be a bit of a run when school got back together in the fall months, starting here in mid-August, but certainly not this. So anyway, it is our reality and we got to deal with it and manage it the best we can. So about 63,000 people in our community have been vaccinated. We are seeing an uptick in vaccinations over the last 2 weeks, but just slightly, nowhere near where we were at our peak vaccination weekly rate. So that's still disconcerting, especially because of the Delta variant being out there. As I said, broke a record today in a hospital. The thing about the Delta variant is it can provide a viral load and it can be transmitted by either a vaccinated person or an unvaccinated person. And the viral load is 1,000 times more than any previous mutation, you know, like the Alpha from Britain and others before it. So it's very transmissible. It is as contagious as the common cold or chickenpox. And quite frankly, that's why we're seeing this, you know, tremendous surge in the hospital with cases and cases for us to investigate. You know, they are certainly concerned. And I know that they're doing the very, very best. Wally DeCino and the whole hospital team have been great partners, along with Jonathan and myself and Dr. Bickle, our medical director. Jonathan is right in that the number of deaths, we're not seeing that. Deaths still total 114 in our community. 4 patients died who were hospital patients. They succumbed not this past weekend, but the weekend before. Keep in mind that there is a lag between hospitalization and those that end up in the ICU on ventilators, which they do have right now at the hospital. I know you all heard that they are in code black status, which means that all elective surgical and other outpatient procedures are on hold right now. So only emergent activities, so that OR staff, PACU staff can all help the nurses out on the units caring for all these COVID patients. You've seen the photos, you've seen the videos of how they have to get dressed up, and it's a, you know, team formation, all hands on deck, just like it is here at the health department, just different functions and activities. So 80 cases today being investigated. So that's status on vaccines. And I gave you just a little, you know, our take on the Delta variant being more transmissible and definitely more serious. So I want to share some good news with you, because it is good news and you're going to hear about it probably tomorrow through a PSA prepared by Gretchen Smith, our PIO, and Jason Wheeler, the school district's PIO. And you may have caught some of it on West TV News the last couple of days, well, last night actually. But the good news is that we have found and have come to an agreement with the school district on employing rapid testing as an alternative to quarantining for 10 days close contacts of a confirmed positive case. The reason why this is so significant, we believe, is because it helps keep children in school. It provides a sense of normalcy compared to last year, even despite Delta being out there in our community. It keeps teachers teaching and it keeps staff of the school district working. So the option, which is voluntary, is basically any close contact, which we have whole classrooms that were close contacts last year. But now there's an alternative. And what it means is you would have to agree to coming to the health department between the hours of 2:30 and 4:30 at the airport annex location, or between 4:30 and 6:30 here at our main location. So convenient hours after school, where our nurses and staff will be available to provide a rapid Abbott Bionex Now test. All it involves is a real simple anterior nasal swab. So 3/4 of the way up. Here's the swab. And then what you do is you do that for 15 seconds each nostril. And then you get your Bionex Now card, you open it up, and inside this top well here, this dot that's got a little hole in it, protected at the bottom, 6 drops of reagents go in. After you get your sample, you stick it into another hole to mix in with the reagent, you close it, and you watch it for 15 minutes. If colors appear like a pinkish kind of color where you have 2 lines on this test card strip, that means you tested positive for COVID. If there's only 1 line, the control line that appears, that means you're negative. So this will be the green card for kids, for teachers, and for staff to stay enrolled in school, in-person instruction, participate in sports, participate in extracurricular activities. And this is nothing new. This has been going on for months now with pro sports teams all over the country and worldwide, the Olympians, colleges, universities. Anyway, all they have to agree to do is come to the health department after hours, after school, every other day for up to 10 days, including weekends. And you've got 2 locations to choose from. And it's voluntary. So if someone doesn't want to participate or starts and doesn't complete the protocol, and then you got to quarantine for the entire 10 days. And that's what's happening in most counties. So we just feel fortunate that the school district is so supportive, also great partners. And what a nice thing to do, because think about the moms and dads that both have to work to put food on the table and pay for rent or their mortgage and not upset the family unit apple cart like previously. There's an alternative, and we're going to deploy it here in Flagler County.
Yeah, it makes sense. And speaking from experience, I have a 9-year-old and a 2-year-old. Well, he's not 2 yet, but he's getting there. But when we had COVID, we were down for 3 weeks, and the kids can't go to school because my wife and I are sick, right? And then flash forward to 2 weeks ago, there was a local daycare that shut down because of COVID. And my the little baby went to that, so now I got to stay home or arrange care for another week. And so to your point, it really is. And I don't know if it was Jonathan, I think, or you that brought up it's really a business continuity thing. I mean, it's putting people out of work, and so where's the money coming from to replace that? How the emergency account is more important than ever, but more than anything else, I think it's just kind of common sense. I want to ask you and Jonathan one last question before we go to a Q&A and kind of an open forum with anybody on the line that wants to ask questions. Is there some sort of other standard? There, a Florida standard? I mean, we know what the CDC is recommending, and I'm just wondering, is there, because the law says, hey, if you're adhering to any standard, is there another one that people can look at that you're aware of?
I'm sure Jonathan would agree, but where we're turning to, he and I as partners and others, that we've spoken to community partners and leaders is follow the CDC guidelines, which, as we know, change. That's the national standard. It's what Florida DOH is following. And it's not, mandating anything, but it's just basically because we're a high transmission state and county, all of us, and because our vaccination rates have just upticked just recently, they all stalled, plateaued, that, it's dangerous. And so consequently, they recommend and urge, mask wearing when we're gathering indoors.
Bob hit the nail on the head. It really is the CDC. There is no separate state guidance. It truly is the CDC. They have scientists that have been studying this since this first started. And yeah, sometimes the requirements change and it frustrates people. We see it on social media. Well, now the CDC is saying this. Now, 2 weeks ago, they were saying something different. But, it evolves. This whole pandemic evolves over time. And we learn something new. And like I said, we were on a good path. And we were not a gigantic risk compared to other communities. But all of Florida, with little exception, is in this current high-risk transmission phase. And it's because of this new variant. And this new variant, as Bob shared, this new variant is behaving very differently. So there are a new set of guidance standards out there. But we can be out of this phase. As easily as we were doing great before, simple little things can get us out of this, get us into moderate where that standard changes. So something the CDC has done different. The CDC didn't in the past have these tiered standards saying, if you're here, here's one standard here. If you're here, here's another standard. They evolved over time and realized, hey, different communities do need different standards based on how the disease is transmitting in their community. So that is what's really new now. And just like we are red or high transmission today, in a week or two or a month or whatever it's going to take us, we could be back in orange or yellow or moderate transmission, and then we would fall under that different tier of standard, and the behavior pattern comes different. And hopefully, and again, I'm not the lawyer, but hopefully Josh would say, then our business liability becomes different, and what you need to follow because the standard is that much different.
Choking out and stopping the chain of transmission here is good for business, for both staff members, employees, and customers. If we got issues or we're scared to go out because of the Delta variant, the businesses are not going to thrive like they would have otherwise. So there's a strong connection, real strong connection. And just some advice. So, we've had outbreaks, right, Jonathan? We've had outbreaks in our nursing homes here recently, summer day camps, childcare centers, ALFs. So my staff, they're constantly on the road doing testing. And it just reminded me, so let's say there's an outbreak in your business, right? An outbreak is, 3-4 cases. Again, remember, Delta is many more times contagious than any previous mutations, as contagious as the common cold, as I mentioned. So what you want to do is, like we're going to do for the school district, is consider getting some rapid testing kits, or work with us and we'll be glad to help. And it's basically, have them come here and we'll test them every other day. And again, that's their green card to remain at work. If they've been exposed, encourage them to wear a mask, of course, because they're before clients and other staff members, but use that rapid testing technology for surveillance, so that it's not an automatic, you're out of here for 10 days and I'll see you after a week. I mean, just, we can help you and the community just be smart about better management of this Delta variant that is 90% out there in our community compared to all the other strains. So I just wanted to just give that possible guidance here for all to consider.
Okay, well, we started on time and I'd like to try to end on time. We got about 10 minutes. If any of the businesses or guests on the phone have questions, I'd like to walk through them. I see Jane's hand, and then we'll keep an eye out. Just kind of raise your hand. So let's go to Jane Neely first and then James Taylor, if that's okay. Jane, go ahead.
All right, thank you. Thank you, everybody, for your great presentations. I have two separate questions for two different roles that I play. First, I am an officer in two 501c3 organizations. Does Senate Bill 72 cover those as well, or is it only private business? I don't know if it's Josh's to answer that.
Greg, I can address that. The statute does define business entity as to include a charitable organization and a nonprofit corporation. So I might need to ask you some technical questions about your entity, but as long as you are registered as one of those entities, you would be afforded the same protections.
Okay, thank you. And then as a elected official, Greg, you sounded a little critical of government when you asked why we weren't doing anything.
Sorry,
And
I didn't mean it that way.
maybe you didn't mean to, but you
Yeah.
did. And Jonathan and Bob did a great job answering. But my question of you is, what would you like government to do?
Chamber?
Yeah.
Yeah, no, I honestly believe the best thing for government to do at the moment is to encourage people to get the vaccine, encourage people to social distance, and encourage people to wear masks in these indoor public settings. I think it's a losing proposition personally, Jane, for government to come out and try to do some sort of mask mandate. It's been pretty clear that the governor is not reacting favorably upon that for school districts. So to me, I think the best move for local governments is just to continue to be the educator. And I think at meetings, it's worth dedicating 5 minutes to say, here's what's happening in our community. I mean, this is real. That would be my answer. And I apologize. I didn't want it to sound that way, but yeah.
And I didn't take total offense. I just a little.
Okay.
I would like to point out that at least in Flagler Beach, our mayor did put a video on Facebook. She did receive some negative comments, even though she did that, like, who do you think you are kind of remarks. And yesterday or the day before, Commissioner Bryan also put multiple pictures of himself with different masks on, encouraging other people to do likewise. So we are doing something, hopefully.
Yeah. Thanks, Jane. I appreciate you. Let's go over to James Taylor. James, go ahead.
Hello, everyone, and thank you for your time. Thank you for your presentations. As a local business owner, I did read through Senate Bill 72, kind of the PDF version here, but I think it hits the high points. And the thing that stands out to me, in order to protect my business and to protect my customers, if I find myself in a courtroom toe-to-toe with Mr. Woolsey, I think the real question is going to be, what exactly is the authoritative or controlling health standard by which I'm going to have to adhere? And I'm willing to do it. I just want to know exactly what it is, because I can put down a lot of, I can implement a lot of rules of what I think would help. But as far as if I'm gonna have to prove to you, Mr. Woolsey, that I have met those standards, where is that information? Where are you going to look for that information?
Yeah, great question. And that was on the list of things I wanted to talk about earlier, but ran a little bit short on time. And so I appreciate the question and opportunity to answer it. There's they're not great direction on that. And so one thing I would remind you is that it indicates that there's multiple sources for government standards and guidelines. You need to comply with one of them. And so I would tell any business that if you are looking at state regulations, federal regulations, the CDC, those are the things that you should comply with. But to be fair, James, I mean, you could end up, we could end up hearing from the courts down the road where they try to better define what are the government issued standards or guidance. So we don't know how the judges are going to interpret that language, or which ones they're going to say are the control, because remember, they have to be authoritative and controlling. Well, what's authoritative and controlling? And so I'm sorry that I don't have a perfect answer for you, but I think that's where these judges are going to have to help us understand to be safe. You know, the CDC would be something that I would think would be easily determined to be a controlling government issued authoritative resource for standards and guidance. And I wanted to leave real quick, didn't want to leave this for everybody thinking that us plaintiffs lawyers are sitting here drooling over bringing lawsuits. Before this immunity bill, I met with multiple families who've lost loved ones, and we didn't bring claims. I mean, we're all in this together. I have a business as well. It's the egregious things that happen where there will be lawsuits brought. There's, just like any profession, there's bad lawyers, and some might bring less than meritorious claims, but generally us plaintiffs lawyers are using our judgment and evaluating, is this egregious? Is this something that should never have happened and could have been prevented? And so I didn't want to leave it that we're all sitting here drooling over bringing lawsuits against y'all's businesses. That's not the case. But good question, Jim, and sorry I don't have better direction. I'm happy to follow up with you if I see some cases where judges are weighing in on that question.
That would be at a circuit court level to start out with, right? It would be here.
Yeah. And to be fair, some could be in county court, but you're right. Most will be in circuit court, the circuit court level.
And as long as we're just being reasonable, because it looked like it said you have to be egregious disregard for public health safety in order for the case to continue. If we're doing everything that we can be reasonable human beings and taking care of our people, that the case is probably not going to go forward. Do you agree with that assessment?
Completely agree. And that's the good faith standard, in my view, is exactly what you're saying. The judge is going to look at it and say, was it reasonable? Was it reasonable for Jim under his business to believe that these were the standards that he should comply with? And did he make a good faith effort to comply with those, with really, I say those, but it's at least one source of government issued health standards or guidelines.
Thank you, sir.
And James, I would agree with what Josh said. You know, to me, that's why I thought it was important for the chamber to come out and say something like this. It's not about Trump or Biden. What it's really about is, when I read Senate Bill 72, and this is why I asked Bob Snyder and Jonathan Lord this, I know the CDC, we all know CDC. If there's another standard that is authoritative and controlling, then great. I'd love to tell you to follow it so that you could adhere to the law. But me saying nothing and you not being engaged in any conversation is not a real solution for us, right? And so I agree. I think CDC is the safe way to go. But to Joshua's point earlier, you may look at these recommendations from the chamber and from the CDC and say, hey, you know what? We're okay not doing it, and that's your choice too. Just your risk goes up, and that's what we're trying to avoid.
It's entirely possible that we could have a different state set of guidelines than we could at a federal level. And if we chose to follow, if we just happen to agree more with the state one than the federal level, are we exposing ourselves?
And Greg, I can attempt to address that. It's another good question. I've seen there's a statute that's similar that deals with the health industry. And it goes into a little bit more detail in the definitions, and it talks about state or federal. And so, Jim, without the courts weighing in, my opinion would be that if you comply with a state authority that issued standards or guidance, you would be fine.
All right, and one last. Yep, you're welcome, James. One last thing on Josh, Josh, really appreciate. Josh is one of the good guys, James, because he's here telling you what the other side is looking at. And I am just so thankful for Josh being here to do that. And I think it's really helpful for all of us on the phone to understand kind of how the attorneys are seeing this, because at the end of the day, that's what we're talking about. But look, it's 5 o'clock, everyone. We're going to go ahead and wrap this up. If you have any questions, feel free to email me at greg@Palm Coast-Flagler Regional Chamber.com. If you do not check the website, just know that we do have a pretty robust news page on there. You can click over to the Chamber's news page, and we post updates there fairly regularly. It's pretty simple. It's website, click on news, and then, you know, you've got the kind of what's happening in the community here, and here's the COVID liability one there. So with that having been said, I really appreciate everyone's time today. Go out there and be safe, make the best decision for each of your individual businesses. For Josh Woolsey at Woolsey Morcom, Jonathan Lord at the Flagler County Health Department, and Bob Snyder with the Flagler Department, Jonathan Lord with the Flagler Department of Emergency Management, and Bob Snyder with the Flagler Health Department. Really appreciate your time today. Thanks, everyone.
Thank you.
You're welcome.